This is the Leo Climaco podcast.
I want to real quickly break down exactly what it means to be a BCBA. What is a Board Certified Behavior Analyst? What can you do with this?
Sure.
What does that entail?
A lot. So it encompasses a lot. What can I do? Starting from the beginning, we assess a child. We look at where the child is, what their skills are, what their deficits are, there are numerous assessments that can be done.
Okay.
Based on the child's level, we choose what is most appropriate to see where they are.
Would you mean like there's a physical assessment, a reading one, and something like that?
There's assessments called, for example, like the VV map or the Vineland, which the AFLs or the ABLs. So what I would use for a 14-year-old, I wouldn't use for a 7-year-old.
Got it.
What I would use for someone who is verbal, I wouldn't use for someone who's nonverbal.
Makes sense.
Someone who is, able to do daily living skills versus someone who is still learning how to do basic functioning, needing help with brushing their teeth and washing their hands. And it really depends on the child. So you go in learning the child and then deciding on what assessment is most appropriate.
Okay.
So that's the basic.
Got it.
From
How
there,
long are these assessments?
Again, depending on the child.
Yeah.
Usually you go in starting about an hour and a half to 2 hours. Spending time with the child really looks like play.
Right.
You don't want to put too much pressure.
You're observing, interacting.
Right, you're observing, you're interacting, you're kind of seeing where they are. What are they doing? Really natural. You just kind of want to see what their skills are.
Right.
I kind of ask them, can you do this for me? Basic things. Can you come sit with me? Let's read a book together. You can get a lot of skills there. Do they listen? Can they sit with you?
Right. Can
they make that eye contact? That parallel play, that interaction, because autism is really a social skill deficit. So just
a social skill deficit.
Yeah, it's really.
I like how you put that.
Yeah, it's really just that basic interaction. You can get a lot from asking a very simple direction. So really, I don't come in with a book. I don't come in,
Right.
I come in very naturally.
As a friend.
Yeah.
Come in to play.
Yeah, I come in to play, and I tell the parents the same thing. I come in, it looks like play. Don't be alarmed.
Right.
It's gonna look like a free-for-all. I don't want it to be. I don't really want the child to know what I'm doing.
Right.
Because you don't want them to change.
Right. You want to catch them in their natural habitat.
Yes,
right.
Because you can't really assess what's happening if they are performing. You don't want a performance.
Right.
You want to really see what they're able
who they
to
really
do
are.
exactly,
right.
or not able to do. There's a whole interview with the parents. You get the parents' point of view.
Okay. So you're getting the full picture.
You're getting a full scope.
Yeah.
So it's a start. So you start there. You get the basics.
You get the assessment done. What do you do next?
You build goals from there. So you start with.
So you basically write a whole report, basically, right?
You write a whole plan.
Yeah.
You create program goals. If there are maladaptive behaviors, which can be anything from severe behaviors, could be self-injurious, can be anything from throwing items, biting, hitting, scratching, hitting themselves. There's a range.
What kind of training is there for therapists to be able to handle these situations?
So what I have chosen, the training that I go through, is called CPI, which is Crisis Prevention Intervention. And that's what we use at Behaviors. And that is a de-escalation, which is why I like it, because it really teaches you everything that you can do to de-escalate the situation before you put your hands on the child.
Okay.
Because you have to think of the situation. The child, once they're in a heightened space, once they're in this meltdown, there's no consciousness there.
Right.
So if you're going to go in and put your hands on them, they are
Going to get aggressive and defensive.
Completely.
Yeah. Naturally, right? It's
Naturally.
instinctive.
So if you're able to kind of calm down, usually you can kind of get them to come to your level.
Makes sense.
Sometimes that works, sometimes it doesn't. And then there are certain holds that you can do that also help calm down. There's a whole, there's a whole psychology behind that as well.
Right. While you staying calm as well. Like,
While
right.
you
Yeah.
stay calm.
Yeah. If you panic, everything.
Correct.
Yeah.
Correct. So there's a whole training, a way to talk them through.
Very important.
Very, very important.
Yeah.
Because you're kind of talking yourself through it while you're talking
Right.
them through it as well, because everyone is heightened.
Right.
There's also a way once.
And you're the specialist.
Yes.
Right? So you got to remain calm.
Have to remain calm. And even afterwards, there's a whole protocol on how to take a break, to give yourself a break, to give the child a break, to offer everyone water.
Give me a scenario where you were working and you had to implement CPI, and how did it go?
Wow, one scenario, okay. I can give you several. So there was a time that I was working at a clinic, and there was a child that was severely aggressive, and there was a team of us because that's how aggressive he was.
Wow.
I was the lead, so I was the one that was directing, how to speak to him, when to speak to him,
Right.
when to have hands on.
You were the negotiator.
Okay. Yes, I was.
You were the negotiator.
Yeah, it was.
What did you have to do exactly? He got aggressive. He was hitting. He was kicking. What was he doing?
Yes, he was lunging at us. He was a big boy. He was 16, and he was coming at us. So there was 5 of us. We happened to all be women. So it was a full takedown. What does that mean?
Arms, legs.
Arms, exactly.
Yeah, I can picture it. Full arms, legs, and take him down.
Head. Gotta be careful.
Of course, the head. You can't hit the head.
Careful.
Concussion, yeah.
Pillows. So you have everything in the room.
Got it.
You have a pillow to make sure that when he's on the floor, there's a pillow under his head.
Right.
Because you have to remember, it's safety.
Right.
What's the safest way?
You're not going to, like, the aim is not to harm. It's to de-escalate.
Right.
Yeah.
The child is literally in a state where there is no consciousness at that point.
Right.
He really